Good evening, everyone. Thank you so much again. We are live with another session, and I welcome all the panelists today. So we have Dr. Hemant Bid straight away from the US. We have Dr. Chitranshu, I will say budding medical cannabis practitioner, and we have Sumit Sinha, founder of Happie Hemp. So we are today having a very significant session. I think the highlight of this session are two specifically. One, we have a very experienced and very knowledgeable person in the form of Dr. Hemant, and he will be sharing his thoughts and his views about this topic. And we have Dr. Chitranshu with the, I think, first of its kind case study being published in the journal. So quickly, I request Sumit to introduce a bit about this session, the context, and then I will share some of my inputs on this topic today. And then maybe we will listen Dr. Hemant in detail and have the case study from Dr. Chitranshu. So this will be the agenda for the today's session. Sumit, your introductory remarks, please. Thank you.
Sure. Thank you, Dr. Piyush. First of all, thank you so much to you for organizing such informative sessions, always, all the time, not just with us, with all the company. That's very helpful of you to propagate the knowledge among the community, among the doctors, as well as patients, those who are interested. I think prior to this, last week, we had a session with Dr. Hemant, purely focused on the the therapeutic aspects of cannabis, cannabinoids, and their use cases. It was very enriching content that was shared, and if you have missed on watching the session, I highly recommend everyone to go and go through it, because it contains so much of information, crisp, and everything that you need to know about the cannabis plant, its constituents, how they act and react with the bodies, various cannabinoids, and obviously building upon what we did in the last session, we want to expand the learning horizon. Pain is obviously one of the biggest challenges that we know of. I mean, everybody in their life, some other time, has come across pain. I'm pretty sure that it's a very common ailment, right? And when you talk about a neuropathic pain, I believe 1 in every 10 person of age above 30 witnesses it in their life. So it clearly indicates what an impact it is creating on the masses. And it is very important to understand how this is working with our body, how it is impacting our body, how the functioning of the body gets impacted, how can the endocannabinoid system plays a role into it, and obviously how can cannabis come into picture and help patients have a better quality of life. And sometimes I believe there are even as I think Dr. Chitranshu will talk about it, it's a very good case study, but understanding how cannabis can help in neuropathic pain is very, very important, and obviously will help patients get a better life with more natural and Ayurvedic treatment. I'm so glad that we have this kind of a session, and so glad to Dr. Chitranshu. He worked so hard on the paper, on the journal that has been published. I believe it is first of its own kind to come out from India with the patient. I think evidence is the only way that can drive the space, this whole segment of medical cannabis and how the adoption plays out. And I'm so grateful that his hard work, his medicinal expertise, first of all, and the right using the right knowledge of medical cannabis and the right dosage, as we already talked about, right? I mean, dosage plays a very critical role. So the expertise he carries, and that has been transformed into a life of a patient, that has helped heal the person better. And obviously, we will obviously explore more on those case studies. So I think from my end, I would say that everyone who is watching right now, I think this is something which I said last time as well. Please be connected, because we have two very important people who understand the medicinal cannabis, and those who understand how it impacts our body. Something, knowledge that no one should miss out on. And if you can call fellow doctors, fellow friends who wants to understand medical cannabis and its role in pain, especially in neuropathic pain, please do be associated. So, Dr. Piyush, over to you for introductory remark, and then obviously Dr. Hemant can, and followed by Dr. Chitranshu. Thank you so much, sir.
Right, great. Thanks, Sumit. And I think yes, you are like very well correctly mentioned that as far as this particular case study is concerned, and we are very much proud and happy to see that young people and doctors like Dr. Chitranshu are very positive about medical cannabis, and that was the only reason a few years back we thought, and from last more than 2 years now, we are exhaustively investing our time, our energy to create this kind of discussion, to create this kind of session which impact overall to the fraternity and to the like community. So just I will be just give me a second. Sorry. So just to give a brief idea and the context, when we need to understand about neuropathic pain, definitely we have an eminent expert in the form of Dr. Hemant Bid, and he will be talking about. But just some points I want to discuss right now, and then I will hand over the session to Dr. Hemant Bid, and I will request Sumit also to introduce him prior. He will start his session. So, we need to understand as far as neuropathic pain is concerned. So, there are a few dimensions. Specifically, neuropathic pain is either from the like lesion, um, any kind of a dysfunction in the nervous tissue. Then there can be several expressions, like it can be spontaneous, ongoing. There are two specific aspects which we need to understand is hyperalgesia and allodynia as far as neuropathic pain is concerned. Hyperalgesia is nothing but when we have increase like in the response, but basically the stimuli uh, which is there, so the increase in the response to that stimuli is there, which generally produces the pain. So that is hyperalgesia. And allodynia is like when we are referring, then the pain which is caused by the stimuli are normally not painful, so that is known as allodynia. And both in hyperalgesia and allodynia, cannabinoids have been shown that they are suppressing as far as the clinical studies are concerned. And the mechanism again is through cannabinoids, CB1 and CB2 receptors are being involved. So in several studies, and when we were just going through and seeing the entire research has been done in the animal models as well as the human clinical trials. So on one side, it is actively balancing, I will say, or suppressing these mechanisms. On the same side, the cannabis has also shown that the nerve injury is also being healed and somehow being addressed whenever we are talking about the neuropathic pain, because that injury or damage to the neurons and to the nervous tissue is also a very significant aspect. So in all the preclinical and clinical studies, it has been confirmed that cannabinoids are very much effectively managing, healing, suppressing the neuropathic pain. And however, there are some challenges we need to understand, and the analgesic efficacy and the healing efficacy. There are both. In fact, there is one aspect, the suppression or the control of the pain is there, and on the other aspect, we need to understand that there has to be some kind of an healing. So that is there as far as cannabinoids are concerned. And as in India, we are using mostly the full spectrum. We are seeing, I think in some recent studies, it has been discovered that full spectrums are giving better results. And although Dr. Hemant will share more insights and more maybe information today about the isolates or the broad spectrum or specific cannabinoid receptors as far as his experience is concerned. But in India, predominantly, we are working mostly with the full spectrum medicines. And we have seen that it has been excellent, and we have so many case studies and case details available. It's just maybe we will get a motivation now from Chitranshu that we will also look forward to publish some case studies, and some documentation will be there. But we are again very much happy, and the motto of Indian Vaidyas and the platform is to promote doctors and to grow doctors like Dr. Chitranshu and other who want to really get involved into medical cannabis in our country. And me being the founder, I'm very happy to see these kind of success and being discussed and I will say celebrated on our platform. So thank you again, all of you, for joining. I will hand over the session to Sumit now for further moderation. And again, thanks Dr. Hemant and Dr. Chitranshu for your time. And Sumit, please, you can take over and please introduce Dr. Hemant, and then we will have his discussion as well. Thank you.
Sure, sir. Thank you very much, Dr. Piyush, for the introductory remark. It was insightful, and obviously now I think we will go and let me kind of first introduce Dr. Hemant. So Dr. Hemant, I think is probably one of the most senior when it comes to the researchers in the space of cannabis. He has over 20 years of experience into research experience focused on cancer drug delivery, healthcare management, pharmacogenesis. Currently, he is actually a laboratory director for CP Labs in Ohio, Columbus, Ohio, for cannabis testing. He's also an adjunct professor at Cleveland School of Cannabis. I think you can see the logo of the institute behind him. At the same time, he has published more than 80 journals. That itself says the research quotient of the person. It's phenomenal. And also, I believe that his expertise has been extremely insightful. And he is actually a PhD, and as well as has been in US from a very long time. So I will hand over the session to Dr. Hemant to kind of a deep dive into this. And, we all look to get informed and educated by your session. So over to you, sir. Thank you very much.
Thank you, Sumit, for your kind introduction. First of all, thank you for Dr. Piyush for organizing this special sessions, which is really important for education point of view, not only for the clinicians, but also for the patients to understand that, what is the important and what are the medical applicability of medical cannabis in many different disease subset. And one of the disease that we are going to talk about is neuropathic pain. And I think that it is one of the most important and critical disease pathology that, worldwide people are suffering, and numbers are very high. And pain is one of the thing, and one of the subset of the pain is neuropathic pain. So I think that, before we start that, I would like to, summarize that what we are going to talk about. I think that, most important thing to talk about is that, what medical cannabis is, how it is going to affect in our body, how it interact with our body, and how important it is. And then after that, we need to talk about that, how it is interacting. So of course that we are going to talk about a little bit about endocannabinoid system. And then after that, we are going to talk about nervous system, because it's a neuropathic pain, which is nerve related pain. So we have to a little bit understand about that, what our nervous system is and how it actually works. And then after that, what is already done worldwide with respect to neuropathic pain and medical cannabis treatment. And I think that is one of the important things that we are going to learn today. The reason being is because, it is really encouraging that first case study was published by Sumit and Dr. Chitranshu, but worldwide that, it's a long time ago that, medical cannabis is studied and published, and a lot of clinical data is already out there about medical cannabis. And now it's a time for India to learn all these things and do it in a better way, so that we can actually give a advantage to the patient, that because we have to learn about all those things. Cannabis itself is such a treatment that there are a lot of different kind of challenges in front of us with respect to the dosing, with respect to the pathology, with respect to the diagnosis of neuropathic pain. So there are a lot of things that, and what is the time and when is the time that we need to incorporate with the modern medicine with cannabis. These are the very critical thing that which is very important to talk about. So I'm going to talk about all this aspect. Before moving forward, just a little bit about myself. As Sumit said that, I'm an instructor for Cleveland School of Cannabis from last 2.5 years. involving creating a lot of curriculum editing, CMEs, and teaching a lot of different aspects of cannabis, specifically focused on medical cannabis, as well as the scientific director of CP Lab, which is a cannabis testing laboratory in Columbus, Ohio. And I'm also adjunct professor in St. Louis University teaching pharmacology of cannabis. So it's been quite a journey, and a lot of different aspects of cannabis is coming with respect to the medical field, as well as research is expanding very fast every day. So let's start with the topic. So first, I have no financial disclosure and conflicts of interest with this presentation. Okay, so before we go to the nervous system, we need to understand that, like we have in our body that there is a system which is called endocannabinoid system is present in our body. There are many different other systems, circulatory system, immune system, etc., and a digestive system in our body. So endocannabinoid system is a system that which includes the lock and key. So the key is basically the endocannabinoid, two molecules which body produce, which is anandamide and 2-AG. And there are receptors, which is two main receptors, is CB1 and CB2, which is the lock. And these molecules are go and bind with the CB1 and CB2 receptors. And then after that, the downstream processing starts. So this is how the endocannabinoid system works. And the main role of the endocannabinoid system in our body is basically to maintain the homeostasis and playing a very key role to be a part of a team of our body to interact with many different other the system in our body. And how it happened, because CB1 and CB2 and many other receptors, TRVP1, GPR55, etc., they are all expressing in different organs in our body, and major expression in our nerve cells, which is very important for today's lecture. So that's what we are going to talk about. So that is all about that endocannabinoid system. But on the other hand, that this endocannabinoid system has two different molecules, which is anandamide and 2-AG, which bind with the different receptors, but body cannot produce a lot because body has its own limitation, and these receptors are basically present all over the body. So then what happened that in a disease state, the body need more help, and that's why we need cannabis, which is called phytocannabinoids, which is coming from the plants of the cannabis plant. And so far that more than 150 different phytocannabinoids are already explored. Main phytocannabinoids when we talk about is CBD, THC, CBN, CBG, THCV, etc. But one of the important thing in the clinical aspect we need to understand, as Dr. Pius mentioned, that there are three categories of treatment that we are always looking forward to for the patients. One is that isolate, that means the single isolated cannabinoids, which is only CBD or only THC or only CBG, etc. Another one is broad spectrum, which is basically that all the different cannabinoids will be present there, but the psychoactive cannabinoid, which is THC, will be not there. On the other hand, that, full spectrum cannabinoid, which is highly prevalent in India right now, and every products have the full spectrum, which has the percentage of THC is also there. But again, the THC has a psychoactive activity. It doesn't mean it's a bad guy. I always talk about that because CBD itself actually that minimize the psychoactive activity of the THC, and they actually play a very important role to balance each other. So, and especially that, neuropathic pain, based on the literature that, it is like Dr. Pius mentioned, that it is true that, full spectrum cannabinoids are more and more helpful in the neuropathic pain than any other, other treatment options. So this is the important thing that we need to know, that okay, how we are going to treat the patient, what are the treatment options, how the treatments are going to interact with our body. But now what is in our body in the nervous system? So we have a nervous system. Nervous system is the most complex system in our body, which we divide into two different parts. One is central nervous system, one is peripheral nervous system. When we talk about the central nervous system, it's actually basically includes the brain and the spinal cord. Brain has a high expression of CB1 receptors, and the peripheral nervous system is basically the cranial nerves and spinal nerves. Okay, so then the important thing is that this is our nervous system. Then how nerves talk each other, because this nerve conduction is one of the very important thing, right? So if you look at the image here, these are the two nerves, and they are actually talking with each other, right? So when they talk each other, basically they actually send the nerve impulses from one place to another place. So basically how they did is, that's the most important thing. So this is the typical structure of the nerve, and this is the axon terminal, these are the dendrites. And what happened, especially in the nerve conduction, that these nerves actually send the messages from one nerve to one sensory nerve to the another sensory nerve, which is called synapse here. So that means they are not attached with each other. There's a gap in between the two nerves, but there are the certain molecules and the carriers which actually carry the nerve messages of the nerve from one nerve and terminal ending to the other nerve terminal ending. That's a very cool thing in our body. So basically, as we talk about that, the CB1 receptors are highly expressed in hippocampus, cerebellum, and cerebellum in our blood, in our brain. So basically, what happened in our brain that there are neural networks are there, and the nerves are trying to actually send the sensory information, nerve conduction from one place to another place. So basically, what happened that is fire the nerve from one nerve ending to the another nerve ending. So how it happened in our body? Basically, most of the phytocannabinoids, most of the endocannabinoids, and most of the neurotransmitters, so these phytocannabinoids and endocannabinoids are work like a neurotransmitter, and these neurotransmitters actually carry the nerve impulses from one nerve to the another nerve. So that's very important to understand. So then the critical part is that how these phytocannabinoids are helping us, and how these endocannabinoids are helping us if there is some kind of anomaly and the nerve is not able to actually relay the transmission, right? So then what happened, the different nervous system actually, they have the CB1 and CB2 and other receptors are actually expressing in our terminal ending. And these phytocannabinoids carry this information from one place to another place. So basically that when we talk about the endocannabinoid system, so these endocannabinoids, our body produced it when it needed based on the demand. So when the body produced it, it's go into a nerve terminal ending, and then after that actually that it's go to the presynaptic neuron, you can see here, and then after that it's come to the ending, and then it is release these molecules, which is either endocannabinoids, either it is the phytocannabinoids, or either it is the neurotransmitters, and it's travel through the synapse, and then actually the postsynaptic neurons, there are other receptors that they actually accept that these molecules and transmission is keep going on. So that's how basically that these neurons works, and that's how basically our endocannabinoid system or phytocannabinoids works, because they exactly work like the neurotransmitters. So if the neurotransmitter or there's a dysfunction in our nerve, that they help us to like relay this nerve transmission. Now the question is that we talk about that. Dr. Piyush mentioned, Sumit mentioned that pain is itself is a big problem in the clinical world, and why there's the interest of cannabis for the chronic pain or neuropathic pain. Because there's a high prevalence of the chronic pain or neuropathic pain, there's a relatively lack of the available treatment with a lesser side effects for sure. And there's a huge economic interest also, of course, a favorable media coverage itself. So that's the reason that there is a lot of different interest in this field from a long time. Based on the International Association for the Study of Pain, that they define the definition of the pain itself is an unpleasant sensory and emotional experience associated with or resembling that associated with actual or a potential tissue damage or nerve damage. So that's the whole definition of the pain. So now that Dr. Piyush mentioned briefly, so we need to understand about the classification of the pain, that as we understand the classification of the nervous system. So when we try to classify the pain, there's a nociceptive pain and there's a neuropathic pain, and neuropathic pain that we are going to focus on today. But nociceptive pain is basically divided into visceral and somatic. Visceral is basically divided into vascular and others, and somatic is muscular, all the tendons and bursa and ligament and fascia, etc. But let's talk about the neuropathic pain. So we talk about that just now, the central nervous system, which is the brain and spinal cord, peripheral nervous system, except brain and spinal cord, the rest of the body. So central nervous system had that lot of different kind of injuries maybe happen, or maybe disease has happened, pathological conditions can happen. For example, post-stroke pain, spinal cord injuries, multiple sclerosis, etc., which includes under CNS. And if you talk, these are the few examples that I'm giving here to understand that what is the neuropathic pain and which category it comes to. And the peripheral nervous system induced by the diabetic neuropathy, or either terminal neuralgia, or post-herpetic neuralgia. So there are three different conditions are here. So we understand that there's the two different kind of pains in our body, and today we are talking about the neuropathic pain because it is related with the neurons. So now that understanding the neuropathic pain, that is a neuropathic pain is a disease. Yes, it is a disease. So what happened with the neuropathic pain? What kind of conditions that induce the neuropathic pain? So there are few conditions which are critical conditions that could be lead to the neuropathic pain. Is either there's a traumatic nerve injury is there, or compression is there. Either is the infection, viral infection is there, or either is there vascular related neurodegenerative processes going on in the body, or either there are nutritional deficiencies, or there are a lot of neuropathic pain which is cancer associated. There are a lot of neuropathic pain which is metabolic disturbance leads to neuropathic pain. There's a very common neuropathic pain which is a surgical procedures induced neuropathic pain, and along with that the neuropathic pain is also actually related with the exposure of the drugs, alcohol and toxins. So these are the major actually cause that which can lead to the neuropathic pain. Now, the thing is, like, one of the most important challenging part in the clinical field is to diagnosis of the neuropathic pain, which is really, really important. So when we talk about the pain, so in the clinical field, we always talk about and talk with the patients about the history. That is the history, the relevant with the neuropathic lesion or the disease. And based on the history, then we divide into the patient that maybe it is a possibly the neuropathic pain, or either maybe not neuropathic pain. And if it is yes, then there are examinations, and pain is associated with the sensory sign of the neuroanatomically plausible distribution, and which is based on that we can actually detect based on the quantitative sensory test, laser evoked potential, nerve conduction studies, and somatosensory evoked potential. So there are a lot of like advanced clinical technologies are there which can make us to say that okay, maybe it is probably a neuropathic pain. And with there are confirmation tests of a skin biopsy or corneal confocational microscope, etc., that which can diagnose that confirmation of the neuropathic pain. Because before we treat the neuropathic pain, it is very important to understand and to make sure that okay, this is the right diagnosis we are doing it. And then after that, we have to understand that what happened and what kind of treatment lines that they are present and which is going on from a long time. So based on the literature, what happened, then there are 4 different line of treatments for the chronic neuropathic pain. One is that, like in the clinical field, that either we treat them with a tricyclic antidepressant or either serotonin reuptake inhibitors. Okay, first line treatment, patient is not responding. We move to the weak opioids, the strong opioids. And finally, that if that's not, patient is not responding very well or getting tolerant, then we move to the cannabinoids, where the cannabinoids play a very important role with the combination therapy very well. And then after that, we move to selective serotonin reuptake inhibitors, or which is a fourth line of treatment. On all these different line of treatment is based on that how critical the disease is and where patient is coming from, what kind of the evaluation of the pain. So now the important thing that which you need to understand that what kind of available pharmacotherapy for the neuropathic pain is present in the modern world. So first, like we talk about that tricyclic antidepressant, it's very good. But on the other hand, that every modern medicines come with some kind of side effects. That's what we talk about. So basically that when patient is using the tricyclic antidepressant, then we need to be careful about that precautions that we need to take about that cardiac disease, glaucoma, etc. But on the other hand, it has some adverse effects also, weight gain and somnolence, etc. SNRI, selective serotonin reuptake inhibitors, they have side effects of nausea, abdominal pain, constipation, hypertension, etc. You have to be careful with the hepatic disorders, liver disorders, cardiac disease, hypertension, etc. On the other hand, that calcium channels are very effective also, but dizziness, weight gain, etc., is the side effects. Reduced dose for the kidney, abnormal kidney function should be a concern. On the other hand, that topical Licoden is also kind of like a important aspects. But on the other hand, if you see about the opioids and neurotoxins, so opioids, of course, we know that, like addiction is one of the issue. Along with that, the nausea, vomiting, constipation, dizziness is also a side effect. So there are a lot of options we have, but there are a lot of options are coming with a lot of different caution and the side effects that we need to understand that. Because it is important that, we need to understand about that what kind of medications are helpful and how much they have the valuable treatment options are there. Along with that how much they are going to have a side effect. So it's kind of like a balanced thing, right? and basically to understanding all these medications which is present in the modern time and which has been explored very well for the neuropathic pain. It is giving us the opportunity to combine the cannabis-based medication with them also. And that's why it is important to understand that what these medications, what are the medications that exist in the modern medicine, and what are their different precautions that we need to understand about, along with that, their side effects. So now the one of the important thing that also Dr. Piyush mentioned briefly, and that's why we are talking about here, is cannabis and neuropathic pain, because very two important critical aspect of cannabis that which correlate us with the neuropathic pain is the paper is published a long time ago in PNAS, which is one of the breakthrough papers in 1998, that CBD and THC have a neuroprotective and antioxidant activity. So now a question is that what is neuroprotection? So neuroprotection is a effect that may result in a salvage, recovery, or regeneration of the nervous system, of the cells and the structure and the function. So this is one of the biggest thing that which is basically indicates the not only the therapeutic but the preventive aspect of cannabis. On the other hand, that it is also have an antioxidants. So basically what happened, that antioxidants are the molecules that can prevent or slow or damage the cells caused by the free radicals. So antioxidants, that antioxidant property is a unique property of cannabis or any other substances also. They can prevent or slow down to damaging the cells by the free radicals. So these free radicals are the unstable molecules in the body, which produced by the reaction of the environmental, other pressure, many other reasons. And then these free radicals are the bad guys, and they are going to actually eat the healthy guys. But the molecules like cannabis-based molecules, THC, CBD, and many others, they have an antioxidant property. So that means they are going to protect the healthy guys from this free radical bad guys and protect the cells. So these are the two important aspects that, why cannabis is so much helpful in neuropathic pain. Okay, then after that we talk about that, what are the different trials it's already done so far. So if you look here, there are 3 trials here that, which are the recent trials, clinical trials, which have been done. And the numbers are, number of the studies you can see here, 5, 9, and 9. And I just wanted to hear that, conclude that, what are the conclusion of the authors from these 3 trials? So inhaled cannabis appears to be provide short-term relief for the chronic pain. One conclusion. Second is the administration of the nabixilum oromucosal spray, which is Sativex. I'm going to talk about that in patients with chronic non-cancer neuropathic pain, is basically significantly benefit them. On the other hand, cannabinoids have weak recommendation against their use of neuropathic pain, is the third one, which is kind of like another study that there are a lot of studies that which claim that, patients are not significantly improved based on that many different factors. So this is one of the important studies that recently published in 2020 in the randomized control trial. And what they said is basically that transdermal application of the CBD oil, it can achieve a significant improvement in pain and other disturbing sensation in the patient with a peripheral neuropathy. And this paper is published in current Pharma Biotechnology. Very important paper because they actually use the CBD oil. And the most critical actually finding that what they said is that the treatment product, that means CBD oil, as well as tolerated and may provide a more effective alternative compared to the other current therapies in the treatment of peripheral neuropathy. So this is one of the important among most of the, many other studies. And now we are going to talk about the one of the cannabinoid-based medicine approved already, which is called Sativex. And it has actually 27 milligram of THC and 25 milligram of CBD and lesser amount of different cannabinoids. So it is a specific cannabinoid extract, which is been approved 2010. That means, it's been like 12 years now as a botanical drug in United Kingdom. And it is sold as a mouth spray intended to alleviate the neuropathic pain, spasticity, overactive bladder, and other symptoms of multiple sclerosis. And it was developed by one of the biggest pharmaceutical company which has been involved to develop the cannabis-based medication is GW Pharmaceuticals. So this has been used from last 12 years. And there are a lot of reports. I'm going to talk about the 3 specific reports about Sativex, which is really, really encouraging. It is one paper published in Pain Medicine, and which has been meta-analysis for the many different randomized placebo-controlled trials. And what they said is basically it is superior to the placebo for the reduction of chronic neuropathic pain with a smaller effect size. And they encourage the larger controlled trials need to be designed. On the other hand, another paper recently published in Expert Review Neurotherapy is safety and tolerability, which is very, very important aspect for any drug development process. And more than 15 years of the investigation of Sativex in muscle plasticity and chronic pain conditions indicates a acceptable overall safety profile, which is very, very encouraging. And 2007 in the Journal of Pain, Sativex successfully treats the neuropathic pain characterized by allodynia, which Dr. Piyush mentioned. So this study shows that the initial pain relief was maintained without the dose escalation and without any toxicity for 52 weeks, which is really encouraging. Now, there are a couple of more studies published in 2020, which they said that, some of the preclinical studies, and they said that basically that they have a better efficacy to the adverse profile. And for all the audience that who are interested to understand about the neuropathic pain and so far what kind of studies has been done in cannabis, how CBD help in neuropathic pain, how broad full spectrum help in different dosing regimens, and etc. So there are a lot of resources are available, and these are the resources I'm showing here, that all the different books are very, very helpful to understand that what research has been done, what clinical data has been done, what are the different clinical trials have been done in neuropathic pain, which will give a lot of perspective to understand that how cannabis-based medications helps in the case of neuropathic pain. Now, this is the summary of that, how basically that, mechanistically that our brain works and how cannabis-based medication actually help our neuropathic pain. So far that we talk about that CB1 and CB2 receptors are in our brain, right? So what happened that cannabinoid receptor activity is basically inhibit the ascending nociceptive transmission. You can see here that CB1 receptors are there, and it inhibits the ascending nociceptive transmission to the brain. And what happened when it inhibits this transmission? When it inhibits the transmission, is basically further activates the inhibitory descending pathway, which you can see in the down here, that is basically activate the downstream inhibiting pathway. And then after that, what happened, that it's modify the emotional component of the pain. And that's how that it's basically helping that so many different, case studies in the neuropathic pain for many different, patients. Now, this is kind of like a summary of how it does. So this is the brain structure, and brain has, so many different parts, and this is the structure of the brain cells. And what happened that CB2, CB1 receptors are expressed in the peripheral and central inflammatory cells, and these are the macrophages or microglia cells, which is expressed, which the CB1 and CB2 receptors are expressed there. So as we discussed that basically that it's the two neurons which work together and they actually talk together. So these different receptors are expressed. You can see in the right hand side many different receptors, which is a part of the endocannabinoid system present in those cells, which is CB1 receptor, CB2 receptor, GPR18, GPR55, and TRVP. And all these different phytocannabinoids are either endocannabinoids or either synthetic cannabinoids. They go and bind and relay the transmission the way it should be if there is some kind of anomaly and patient is suffering with a neuropathic pain. And that's how that, cannabis worked in the case of neuropathic pain. Now, it is very, very important to understand in the clinical perspective that how we are going to treat and what kind of different treatment regimens we have it. So there are three different kind of approach in the clinical field we take it, and there's a very good publication right now published in Journal of Cannabis Research. And what this says is that recommendation on the dosing and administration of the medical cannabis to treat chronic pain based on so much, research has been done so far. So there's a routine protocol, there's a conservative protocol, and there's a rapid protocol. Now, why we have three different protocols? Because there are so many different kind of patients, and there are so many different conditions of the patient in neuropathic pain based on their scaling, right? So basically, the routine, this is the routine protocol where you can start with the CBD prominent and then 10 milligram per day. and then you can see that how it is moving on, and then you can increase the dose. On the other hand, the conservative protocol, that you can start with the 5 milligram and then go slow, low and slow, and then see that how patient is improving. If patient is not in a condition that where he is in a very bad condition and unbearable condition. But if some patients are coming with a really unbearable condition, with suffering from a chronic pain from a long time, then you can go with a rapid protocol, which is basically that you can combine the full spectrum balance with THC and CBD with 2.5 to 5 milligram of each cannabinoids, 1-to-1 ratio, and then after that 2 to 3 days of each cannabinoid, that twice daily, and see that like how patient is responding, and based on that you can move on and change the treatment protocol. Now, one of the very interesting approach, logarithm approach, recently published, and this is, I think, very fascinating, that what the amount of studies has been done worldwide, and giving us a comprehensive logarithm approach for the cannabis-based medication is really exciting. So what this report said is basically that first is when you're going to treat with the patients in clinics, the comprehensive clinical evaluation need to be done. And then after that, start the multimodal treatment. That means education, non-pharmacological therapies, and start with the first line and second line therapies that we talk about before, that they are a first line therapy and second line therapy. And third line therapy is cannabis come. So then after that is the first line and second line therapies. Patients are not responding very well, consider a trial or consider a treatment with cannabis-based medication or medical cannabis. But for that, you have to establish a pharmacological and non-pharmacological therapies which are effective, not tolerated or contradicted. And then next step will be the share the decisions making with patients when considering a trial of cannabis-based medication, because there is a benefit and risk ratios, informed consents with the patients, along with that realistic treatment goal, and of course that drug abuse, etc. You need to consider all those things. And then after, in the 4th week, they start go and slow and see, monitor the patient, that how patients are responding, and based on that you can decide that either it will go for a long-term treatment or a short-term treatment. So it's such a very comprehensive report, and come up with a approach that which is giving a lot of insights for the clinicians in the medical cannabis field, that which is really amazing. So finally, that I'm going to conclude my talk here, and based on that what we talk, that neuropathic pain treatment continue to be an unmet medical need, as patients keep reporting inadequate pain relief for sure, and clinicians continue to have a problem dealing with how to face the pharmacological strategy when first line treatment fails. That's what is the big challenge right now. Of course, combination therapy has been a practice adopted for many years, but the evidence is not solid. That means more and more practice and more research evidences we need. And guidelines for the neuropathic pain should attempt to make recommendation about the combination therapy research, and prioritizing which combinations to analyze one over other, so that the search for the better evidence can take place towards forward. And here that I wanted to mention here, that so far that what we talk, and you can understand that how many different studies and how much valuable studies are already done. But it is very important to understand that it is an ethnic variation thing. Ethnic variation is one of the most important thing, because we need data from the Indian population, because our genes are different. So how patients are responding, how patient and all the products are different also worldwide. So how patients are responding, we need to create a standard operating protocol for the neuropathic pain for the patients, that in an Indian subcontinent, because ethnic variation is different, gene pool is different. So how our patients are responding with our medical cannabis treatment is way different than any other country. But definitely we need to take advantage of all the research breakthroughs already happened worldwide, so that we can give a better treatment regimen to our patients. And that's the way to go for right now for the for India. And it's a very exciting phase that we are using medical cannabis for many different disease subset, and hopefully that gradually that we are going to have more case studies and more data coming. And congratulations to Sumit and his team to publish the first paper on neuropathic pain as a case report, which will be very valuable for long-term studies. Thank you.
Thank you so much, Dr. Hemant. It was really informative. I believe, there's so much information shared, and I would kind of probably also summarize from my point of view is that obviously a lot of research has happened, as we clearly saw in your in your presentation. And Sativax obviously came, I believe, 10, 11, 12 years back, and and a clinical trial has already happened in India with Sativax. If I remember, I think 168 patients participated for advanced cancer pain management for Sativax in India. Right. So the cannabis and its medication is not new. Obviously, this kind of takes the entire aspect that Ayurveda has also and already from all the time has actually considered a therapeutic impact of the plant, has always been legal under the Ayurveda. I mean, so many classical formulations exist that includes cannabis leaf as an API and has been established, information that a lot of healthcare treatment can be done with the help of the plant, right? Unfortunately, yes, it is true that not a lot of data has been published and obviously been shared in the domain. Demography is completely different. The genetics of the populations are different, and the strains of the cannabis plant is also different, right? So we're talking about multiple layer of different components that needs to be studied, because we're talking about different gene, different genomics of the plant available in the West countries, because of their own geographical and climatic conditions that impacts the phytocannabinoids and their expressions. And obviously the human genes are different out there, people and their, the whole culture and all these aspects comes into pictures. And obviously India as a country has a different profile to understand. So I think the first publication that has come out with the help of, and obviously with the hard work of Dr. Chitranshu, is probably the first of its own kind. But I can assure you and assure everyone that is right now tuned into us that in this year we plan to publish at least 4 to 5 more research papers with more and more participation of patients. And we would like to, and obviously we would want to address so many questions exist. Efficacy of a medication is one thing on a neuropathic pain or any other symptoms, be it mental health, be it chronic pain, be it neuropathic, be it Parkinson, be it Alzheimer's patients, or so much can be solved, and so many questions comes when you make such tall claims, when you put a medication or a plant into center of it. As a company, Happie Hemp is very much committed to produce original research work that can ensure that people have the confidence. More and more data comes out that can help either the entire community of consumers, patients, to have more confidence on the medicine. Obviously, the fraternity of doctors, the practitioners can have the faith of the medication that has always been established by our Veds and has been a part of our cultural aspect. So I think we would like to definitely move on to the next phase of our discussion. Is I would invite Dr. Chitranshu and just tell you a bit about him. And there are 2 case studies he will be talking about. One is the first one will be the one which has already been published in a peer-reviewed journal. So first of all, so many congratulations to you, Dr. Chitranshu.
Thank you, sir.
And a bit about Dr. Chitranshu. So he's a Ayurvedic practitioner. He's a BMS from HNB Garhwal University. He's also a PhD in forensic and medical toxicology. He is extremely passionate about helping people. I interact with him on regular basis, and I can tell you the kind of diligence he has it when it comes to treatment, when it comes to how to go about dosing of the medicines, how to infuse the other Ayurveda treatment to ensure that the best outcome or the best result is there for the patients is there. So without taking much of the time, I would hand over the session to Dr. Chitranshu, and let me just share from my end. And yeah, so over to you, Dr. Chitranshu, for the discussion. And yeah, please go on.
Good evening, everyone. This is Dr. Chitranshu. I am BMS and MD and PhD in Department of Agatand. So here we have this is my first case report on this cannabis use, the Ayurvedic management of trigeminal neuralgia through cannabis, a case report with special reference to Anantwad. So we'll be talking about three major things. One is the cannabis itself. What we'll try to understand what is the cannabis in Ayurveda aspect. Secondly, we'll try to understand what is trigeminal neuralgia and which condition like Anantvat, how can we correlate this trigeminal neuralgia with the Anantvat? And thirdly is regarding this paper. So what I have published. So we'll start with the first slide. The first slide, please. Okay, so firstly, this is about the case. So firstly, we will understand about trigeminal neuralgia. So in clinical practice, what we see is the patient, what the main chief complaint of the patient will be like very sudden and severe excruciating pain, like sharp pain will be there. The patient will be complaining there is a sharp shooting pain specifically in the jawline area and the teeth and the gum. Like he or she must be feeling like electric shock in these specific areas. So the first when we get this symptom, we should have in mind ki might be there can be a case of trigeminal neuralgia. So in this case, what in this case study, what I got is I got a patient, 11 years. She was suffering from this pain from last 11 years, and in 2017, she undergone a retrosigmoidal suborbital craniotomy, and the microvascular decompression of the left trigeminal nerve was removed on in year 2017. And for next 2 years there was no pain, everything was good. But after 2 years, in the end of 2019, she got a single episode of pain for approximately 10 years, and from that day onwards, on and off episodes of pain she was having. So let's uh, come to the this the next general examination. What we'll see is she was having, so her weight was 65, the height was 162 centimeter. She was having a normal BP, and she was having a normal heart rate as per the years, and as per the age she was having this. Her diet was very means she was having a lot of I would not like to say like toxic food, but as per her pragati, she was not having the right diet. The thing was she was having many of the product that were having the what aggregating factors. So firstly, I removed that. Her diet was very wrong according to her prakriti, but she was having good appetite. That was a good sign as per Ayurveda classification. We see she was having regular bowel movement, and she was having very disturbed night routine. She was not able to sleep because after now and then, approximately within a gap period of 4 hours, she was having pain. Episode of 10 minutes, after every 4 hours she used to have a pain episode of 10 minutes. For 10 minutes, she was in intense pain, and then again she tried to sleep. Then again, our 1 or 2 hours, or maximally by 4 hours again. So she was not able to sleep at all throughout the day. She was very restless and was like a lot of in pain. So next slide, sir. Her chief complaint was the chief complaint. What she was saying to me was the pain was everywhere, especially on the left side of the this jawline, the frontal and cheekbone, the lower lid, the temporal region. She was having so much of pain that like she used to what do you call she used to not she was not even able to sleep on her that like left side. And the episodes of pain aggravates on exposure to the cold, to the wind, to the physical exertion, to the mental exertion. These episodes keep on coming Also, there was a one peculiar time, like for a time period of 4 to 6 months, what she was having, if she blows the air rapidly from the mouth, like blowing of the air rapidly from the mouth, like chewing very vigorously, she was having this pain attacks for which can last up to about and a half an hour. So this was very problemsome. These all symptom was there even after this what do you call surgery she undergone. So what I did it, some firstly I rule out she was having this uh, like her appetite was not good. So what I did was, firstly I started a single drop of cannabis tincture in a cup of warm water every day in the evening, only in the evening. And for the dose maintenance, I said to her ki, whenever you have an episode, you just take 3 drops of water, 3 drops of this cannabis tincture in the water, and gulp it rapidly. And if it requires, you can do it for not more than 5 times. So I calculated the dose, like 1 drop in the evening she can take, and if she has an episode of 3 or 4 times or 5 times a day, then it will be not more than 15 drops in total, 16 drops when we will get a calculation. That is 16 multiplied by zero point 0.8 mg. Then like I was having in mind ki she do not what you call overuse this cannabis tincture. So this notorious effect of the cannabis can be avoided. Thirdly, what I did is, as per Ayurveda, we used to advise patients like do the kaval, the prakar of gandosh. You do the kaval with the sandhav lavan in the luke water for 4 times a day. And this was the breakthrough in my this whole treatment. Like where, as soon as I said to her ki you do this kaval, this along with the cannabis, she was like having a very soothness in the specific area, the pain area, and this uh, pain was subsided as soon as possible. Also, I recommended her this avipatika churn 3 grams twice a day before food, in the morning and the evening. And I instructed a specific vihar for her, like ratri jagran is to be avoided, the cold exposure is to be avoided, this cold intake or the cold food should be avoided. And also I corrected her all the diet which was having bath vardhak effect. So what we get in the observation and results were, sir, next slide please. The observation and result was, the patient got relief from the pain after a time period of around about 1.5 months. She got rid of the pain, and this 1 drop in the evening, as I was prescribed previously, was given as a maintenance dose. And this in starting, what she used to do is she used to have 4 or 5 episodes of pain, and then she used to take this 3 drop stats as well as whenever the pain was, and this 1 drop in the night was maintained. And after a period of 1.5 months, this pain episode slowly and gradually reduces. And on the day she consulted me after 1.5 months, she was only taking this 1 drop in the evening, and none of the modern medication for pain was administering to her. So she was not taking any of the modern medicine in this 1.5 month of time period. Also, this Kaval and Gandush was continued for this whole time period for 1.5 month. So it was continued. The effect of this effect of treatment was maintained, and before treatment, after treatment, and after a month, I told to her, you maintain this a patient diary, and you send me this all the things. I explained her what was the pain in intensity over the face, over the temporal region, and the forehead. Before treatment, it was, according to her, it was 10. Then after treatment of the first week, it was around 6. Means there was a reduction in the pain intensity. On the third week, when I checked her out, what is your pain intensity over these areas. It was again reduced, and after a month, it was very much reduced. This restriction of jaw opening, she was not able to open her jaw fully. So what in the before treatment, what I saw is, according to her, she was not able to open her mouth. Like it was, she was only able to insert two finger in the mouth, and after first week itself, this mouth can be widely open. She was not having at all pain at the jawline, and she was not having pain on fast chewing. It was gone after the first week only. The pain over the eyes were less, but she used to have, sometimes she used to have headache. So we even get a consultation with the ophthalmologist for to rule out is this pain is due to this trigeminal neuralgia or due to any of the anomaly in the this eye region. So there was nothing ruled out. So it was pain due to the trigeminal neuralgia, and after first week, she was having no next to no pain. Like sometimes she used to have, but previously she used to have. But after the first week, she was having very less, and after the third week, there was no pain over the eye. And this episode of pain, this is very important. So previously she used to have 4 or 5 episodes per day. So including the night time, she used to have 4 or 5 episodes per day. And with the gradual progression in this treatment, within the first week, these episodes were reduced, to 1 or 2 episode a day. And one day she was used to have, some days she don't used to have any of the episode, but some days she used to have 3 or 4 or 5 episodes. Then she used to call me, and I used to ask her what type of food she ate, what type of food she chew, like she was chewing very fast or very slow, and what all activities she did. Like we came to know, like the maximum time the culprit was the cold, because this time of December and January, she was it was cold, and due to of cold, whenever the cold breeze touches her skin, then she used to have pain. So this episodes of pain used to decline only after I suggest her, you just cover your face with some scarf or something. Do not get the direct exposure of light, this direct exposure of wind. Then it was gradually it reduces, and at the end of month, now she is able to only wear. She is wearing mask, and even though she is not wearing mask, this the episode of pain are very less, next to zero. It's for next to zero, means like for 15 or 20 days. Sorry, she wasn't having any of the episode for last 15 days. So she was very happy about that. So next slide, please. Like now coming to this the portion of the Ayurveda, like now we have to understand how this cannabis works. So like I will try my best to explain to all how this cannabis works. Like when we come to the rasgun viri vipak and the effect, the prabhav of this cannabis, we know like cannabis has a thick ras, that is bitter taste. The qualities or the guna are like laghu gun, tikshna gun, vivai gun. So these three gunas are very important as per Ayurveda. Like she has a tikshna gun and the vivai gun. Vivai gun stands here for like it rapidly spreads all over the part of the body rapidly. Like this cannabis is light in nature, laghu in nature. So like it will even enters the sukshma srotas of the body. Like if we come to the vipak, whenever it this cannabis go that undergoes the digestion, this pungent taste is converted after digestion, and it become katu. And the virya is ushna, and coming to the prabhav of this, this cannabis is having a bath, it balances the bath and kapha dosh in the body. So this is very important. Like when we come to the Anantavad, like coming to the Anantavad, like as per the Acharya Shushruta has explained, there are 11 Shirorogas, and in which there is one Shiroga known as Anantwad. So, like when we compare the symptoms and the pathogenesis of Anantwad, we come to a conclusion like this Anantwad, explained as per the Sushruta, is having a close proximity with trigeminal neuralgia as per the modern science. So, like keeping in mind of this, considering this trigeminal neuralgia as a Anantwad, I went through this patient and used this cannabis. Why I used, because of this Vat and Kaph dosha. What I had in mind is as per her history, she was having like compression of trigeminal left trigeminal neuralgia, and after there was an operation, they released the pressure, but some factors of this depression of left trigeminal nerve, this microvascular depression, they must have led to the bath aggravation along with the pit chair and cuff vriddhi. So what I did is I give the gandush for the cuffs for regulating the cuff. I give the cannabis to regulating the bath and the pit factor and this the cuff factor. So when I gave this cannabis to the patient, she was telling me like pain and everything. She was not able to open the mouth, and these are gone. These are going slowly and gradually. It was this disease was losing the grip and slowly and gradually in the patient. And lastly, the modern aspect is there like THC, which help in the releasing of the pain. The CBD, which is having the neuroprotective effect. This help in the regeneration of the trigeminal nerve, and these both important chemical constituents, they help this cannabis, especially in the cases of this trigeminal neuralgia. Like the bath factor was also controlled with the help of this diet management. The diet was controlled of her. Every bath aggravating factor in the diet was removed, and hence she was having a very good and relief from this pain. And again, there is another case report. So next slide. This is the second case report. This has not been yet documented because the treatment is like still undergoing, and I'm not getting the definitive result as per my expectation. Like I am getting the definitive result, but I'll wait a few more months before publishing this. This is a diabetic neuropathic pain. The female is 56 years of old, and she is a patient of type 2 diabetes mellitus for last 26 years. Next, sir. Her weight was 72, 165 height. Pulse was 80 per minute, and this BP was 110/70. And she was having lot of trouble during the sleep. She was not at all able to sleep. She used to sleep in the night for around about half an hour. Then again she wakes up. Then again for 1 or 2 hours she sleeps and again wakes up, and so on. She was having very disturbed sleep. Next slide, sir. So what I did is, firstly, what I did is I started a single drop of Vijaya for 14 days. During the night, I used to give a single drop of Vijaya for specifically for 14 days. The concept was she was not having any of the history for previous use of cannabis. So like notorious effect like nausea or vomiting shouldn't be there. So I started a single drop in a very low dose. I started for 14 days. Along with this, I corrected her diet. Corrected her sleeping pattern. I started this Vijaya drop in the 7 in the evening. I used to say, you take this Vijaya at 7 in the evening, and you take your dinner at 8:30, and up till 9 you have to be on bed and you have to lie down and try to sleep. Like I corrected all the dincharya and the ritucharya of the patient, and along with that, what I did is I started a teaspoon, like approximately 3 grams of hemp hard seed for this patient, because as we all know, like in diabetes patient, when in the long run there is muscle wasting, and due to depreciation of the proteins in the body, like body is not able to synthesize amount of protein needed for the body. Like there is slow metabolism of this insulin, there is a lack of insulin, there is slow metabolism of protein development. So like what I did is along with this, after 14 days I started 1 tablespoon of hemp hearts seed in the morning and in the evening, specifically with the food, not before food, not after food, specifically with the food. And after 14 days, what I did is I started a single drop of cannabis, that is approximately zero point 0.8 mg of cannabis extract in a drop in the morning and the evening, along with the modern medication. All the insulin, all the modern medication are still with the patient of the diabetes mellitus. And so next slide, please. And before what I started this treatment, and for around about 3 months she was out of touch with me. And after 3 months she called me, like saying sir, before I was having so much of pain, and after this use I am having a very less pain. So what I did is I gave a manual to her. I gave a chart to her. Before you were having how much pain, and after you were having how much pain. You just note it. After first week, what happened, and after second week, what happened. You just write it down and send it to me. Then she sent to me, like as per her recorded reading. There was, like, for the first week there was a reduction in pain to like 3, and after a month there was a reduction in pain to 1. So what specifically she said to me is that I would like to quote is, she said ki previously I used to have pain in my hand region, at my fingers, specifically in my in the biceps area and the triceps area. And secondly, she used to have pain in the calf muscles. She, whenever she used to walk a long walk, she was not able to sit properly, or sit in a padmasan because of this pain. And she used to have all the oils, she used to rub all the oils on all the ointment available. And after that also the pain do not go. But after taking this medicine, then what she used to do is she just used to elevate her legs and use a this oil, plain sunflower oil, and she applied it over the legs, and the pain was gone after half an hour. So what I came to a conclusion in this patient was, there was muscle wasting, and sorry to mention, there was increment in the weight. She was having 2 kgs plus in her weight, and there was a increase in the waist size and the size of the biceps, as per her saying ki, as per the patient saying yes, my body mass has increased, and this I'm feeling far more confident now, because previously I was very lean and thin, and now I'm feeling good. The words was, now I'm feeling good. Then what I did was I said to her, you just continue our treatment of this for around about 6 to 8 months, then you contact me. In the meantime, she used to have she used to ask for the prescription. Then we have a chat. Then I started noting this pattern in her treatment, that she was having this muscle wasting was very reduced. She was having the body was able to synthesize protein more frequently, and she was this the curvature of the body becomes more it was getting thick, and she was feeling good, and this pain was gone. Nextly, 4 or 5 days before, she only told me, like previously there was a reduction in her this HB1AC level also. Previously, it was around about 10.6, And now she, after a time period of 3 months, she again get a routine checkup under her diabetologist, and she was having the proper diet, proper medication along with this cannabis. She again underwent this HB1AC blood test, and now the presently HB1AC is around about 8.8. The present HB1AC, like it was 4 to 5 days back only, she reported me. There is a point to be noted that diabetologists do not change any of the medication except the levels of this insulin. He increased her insulin with my for 8 to 9 dose was introduced in the morning, and 8 to 9 dose was introduced in the evening. The long acting she was getting, he increased the dose, and there was a reduction in HbA1c. But I'm going to be giving this credit to the cannabis. As we all know, this cannabis is also responsible for lowering down the glycolated hemoglobin in the diabetes person, that we have seen in our general practices also. Uh, so next slide is next slide. Okay. Thank you, sir. Thank you. Now
Yeah.
we have, if we have a question, we can take the question, sir.
Yeah, anyone if wants to ask question, they can I think put on the chat box of YouTube. We can see it from there and take it. Uh, you know, while the the questions come up, I would really like to thank Dr. Chitranshu for such an exhaustive information talking about the protocol, how he has carefully managed the case, how he went about the patient, and obviously, I think one of the key things that always comes up is that ask patients to maintain a diary of their progress. That is really, really helpful. And obviously, results are something that over a period of time we have seen come across. I think in our past webinars, we have discussed a lot of cases of insomnia, pain management, where people were dependent on sedatives from a very long time, actually move out from them, and cannabis has helped them live a better life. While we wait for the questions, I think last week, I think I'll post the last week's webinar if anyone wants to deep dive into the therapeutic compounds and to know about it. You can definitely visit that link. It's also available on the Indian Vaidya page as well. You can find it a couple of 2 weeks back, I believe, right? So another information I want to share with all of you is that on February 19th, we are conducting a panel discussion with two doctors from USA, practicing medical cannabis from a very long time, and it's going to be a very informative session. Soon we'll start. I'll put the collaterals out and obviously the registration link for the discussion that's going to happen. I believe we don't see anyone asking questions. So I will, I will probably give my concluding remark on this, and obviously, Dr. Hemant, you can give your concluding remark on it. So one of the key things that, in my experience of being a medical cannabis medicine manufacturer, right, and obviously working with doctors and patients, I've seen is that a lot of conditions that were difficult to manage have been very beautifully managed with the help of medical cannabis. I think in a lot of discussions, the amount of pain intensity for neuropathic pain has drastically went down, as we have seen in both the cases presented by Dr. Chitranshu, that over a period of time, significant decrement has been reported by the patients in their pain intensity, and a lot of other activities they can do much more freely, which was not something that they were able to execute. And a couple of things is that as we have done the publication of this case study, we will generate more and more data for the fraternity, for the community, to understand this space, and obviously the entire, even the policymakers can actually have more concrete evidence to make better regulatory frameworks to promote medical cannabis and its rightful usage. So this is me, Sumit Sinha. I'm founder of Happie Hemp. This will be my concluding remark, and over to you, Dr. Hemant, for your concluding remark.
Thank you, Sumit. I think it's a great presentation by Dr. Chitranshu, a lot of insights. And one of the important thing is that what I realized that, like what you mentioned also.
I'm so sorry. There's one question I would like you to answer in the concluding remark, is that how medical cannabis is useful in children disorders. So just in your concluding remark, if you can add add an answer to that as well.
Yeah, so regarding the children disorder, like it's always been suggested that, growing brain up to 18 or 21, it should not be used by children. But on the other hand, there are a lot of specific disorders like epilepsy that FDA approved cannabis-based medication is already approved by FDA in United States, which is called Epidiolex, which is approved for less than 2 years of children. And very, very encouraging results for all those kids who have the seizures for in a in a month, like more than 300, in a week more than 345 seizures and reduced to less than 10. So remarkable results with that. Safety tolerability is very good. And this is Epidiolex is specifically approved for 2 different forms of epilepsy, Lennox-Gastaut syndrome, and so 2 different syndromes are there. And I think that, in children with epilepsy and controlling the seizures is really, really helpful. And many different other aspects that we are looking for. But again, that, like we discuss always, that there are a lot of aspects that we don't know. And we don't know that, how long term that how much it is going to affect. For example, then we talk about the pregnancy and effect on the fetus and growing kids and everything and all this stuff that, it needs a long-term studies and which is continuously going on. But definitely that, there are specific areas like epilepsy is very, very helpful for the kids. And continue to that, like what I was trying to mention here, that, it is really important and I think very critical that what Dr. Chitranshu and Sumit did to publish the case report in Indian subcontinent and patient that how they were treated. And there are a lot of critical, things that we are learning from that case study. Is first thing is that, how they treat the patient, because of course that, different patients are different. Different kind of, combinations are different products are different, as well as that, how patients are feeling and how we are going to judge the patients or keep in eye that patients are not going to get tolerant or patients are not going to moving to that direction that they are asking more and more. That means, it's going towards the path of the addiction and all this stuff. These are the important things. And as well as to publishing these papers actually giving a lot of, faith on the medicine in itself in India in many different clinical field, as well as I think that, not only in neuropathic pain, but in many other diseases also, I think that, having a clinical and Ayurvedic doctors on board together will make a big difference, because, it needs a lot of coordination, because there are a lot of modern medicine, which is really valuable for many different diseases, but combination with the pharmacotherapy of cannabis-based medication makes a huge difference. And one of the biggest example is that, Parkinson disease, where there's no therapy is there, and only the levodopa is one of the therapy. And then, patients are not able to produce dopamine. And then there are a lot of, good help from levodopa. But on the other hand, that, after 1 year or so, that patients are seeing a lot of different side effects, akinesia, dystonia, muscle stiffness, etc. And then, those side effects, cannabis can manage those side effects very well. So these are the different kind of aspect that, we need to thinking about that. And we need to also, educate ourselves as a patient, educate ourselves as a clinician, as a doctor, which will build the key to go, because, more and more you understand and educate about ourselves, that what kind of research is already done, what are the basic prospects, what are the different dose regimen, what are the different kind of, therapy is available, what kind of different types of like medicines are available, either edibles and tinctures, etc., will be very helpful for the clinicians to treat the patients, and patients also have a lot of options to ask questions to the doctors that like, I have this kind of medicine is already going on, can you give me some other options, which will be very helpful. Thank you so much.
Just another question has actually come up from Sanchita. Is the treatment possible for someone who is a heart patient and went through angioplasty and suffering for neuropathy pain because of long diabetes? Will there be any impact to heart patient? And post your answer, Dr. Hemant, I would also want Dr. Chitranshu to comment on this. So did you get the question?
Yeah, can you read the question again? Sorry.
Is the treatment possible for someone who is a heart patient and went through angioplasty and suffering from neuropathy pain because of long diabetes? Will there be any impact to heart patient?
So basically, that if you think about that, like different category of the treatment, isolate, broad spectrum, and full spectrum. Definitely, full spectrum is not suggested for this subset of patients. And unfortunately, that India has not availability that easily for the isolates that we can start with. CBD isolate with specific tinctures will be very helpful. But here in US or Canada or European countries, that people are treating this subset of patients, and there are case reports are there and getting helpful. But we have to start low and slow because of so many different diseases and interactions of cannabis that like we don't know exactly that how is going to impact the patients, because there are so many different complex situations are there that not everything is reported and everything is explored. But I wanted to hear Dr. Chitranshu's view about that.
About the question, for the patient undergone an angioplasty and heart is a heart patient. Firstly, like cannabis in the first shot is not recommended, but if we have to use cannabis, it should be with caution, because as sir has mentioned it, in India it is not allowed to use the isolate. Only the full spectrum is allowed. So what we can do is if we have to use, if the patient is insisting, like what we can do is we can use a very low dose of cannabis tincture, and yes, it is possible, but under the strict supervision and direction of the clinician. So, Sanchita, is it okay? You have to get in touch with one of the doctors who is practicing cannabis, is a cannabis practitioner, and get a prescription from them, specifically from them. And you have to be in regular touch with the doctor, because there are many fine things which we have to keep in check. Like we have to keep in check the triglyceride and other medications, the modern medications you have been prescribed. Is some prescription we have to get it changed, and some prescription we have to use it with caution. Like it is possible to use, but with caution, with the person having a good knowledge of this medical cannabis.
I think that Dr. Chitranshu, one thing that we also need to mention here, that one important thing is about that using medical cannabis in this kind of complex situation is all about the risk-benefit ratio.
Yes, sir. Yes, sir.
That's the most important thing,
yes,
right?
Yes.
So,
yes.
Because if we talk about the epilepsy also, that like okay, if there's a less than 2 years kid who has more than 300 seizures in a week, is it then as a clinician you have to decide that either the kid is going to suffer for so much of a seizure, or either we are worried about more that long term how is going to impact his brain development, right? And on the other hand, that like this kind of situation, I think that one of the most important thing that what you mentioned is under strict under supervision of the doctor, clinicians, because the reason being is because we should not forget about that these kind of complex situation patient is already taking different kind of medications, and drug-drug interaction is one of the critical thing in the field of medical cannabis. And we know a series of drugs, either it is tamoxifen or SNRI, that like cannabis has interaction with them. But still we have a lot to know about that what kind of different medication, especially somebody went through the angina and angioplasty, and then after that having a certain medication for hypertension or diabetes, etc., that what kind of interaction of cannabis based medication with that. And as report said that like CBD and THC itself, they are the inducer and the inhibitor of liver metabolizing enzymes also. We should not forget about that also. So that's why it is really important to think about this kind of complex situation, about that risk benefit ratio, drug interaction, and under the strict supervision of the medical as well as Ayurvedic doctor, for sure.
Okay. Thank you, both of you. I guess, Sanchita, the answer to your question is that you have to be, this has to be done in a very close observation of a doctor who is experienced, an experienced medical cannabis professional, so that the person, as iterated by Dr. Hemant and Dr. Chitranshu, can have a very clear-cut understanding of either the drug interaction or the dosages, and how to kind of have a smoother treatment protocol. So I guess we had a very interesting session, very informative session, and I would thank both of you for joining, and also Dr. Piyush for this wonderful platform. And on this note, I would end the session. Thank you again so much, Dr. Hemant. Thank you again so much, Dr. Chitranshu, and thank you everyone for joining us. I think again I'll repeat it, on February 19th we will have a panel discussion with two senior medical cannabis practitioners from USA. They'll be joining, sharing questions. We'll be asking questions to them and getting their knowledge and how medical cannabis for them have been the journey experiences. So on that note, thank you so much for joining, and I'll end the